latest on vaccine rollouts and the Delta and Beta COVID-19 variants with Mia Malan. She's the editor-in-chief at the Bhekisisa Centre for Health Journalism. Mia, good evening to you. Always a pleasure getting these updates. Firstly, let's talk about the vaccine program. So the registration of the over 50s seems to have been brought forward. Does it also mean that they'll also get vaccinated much sooner than that 15th of June that we're told, July rather, that we're told about?
Yes, it does mean that, Kathy. Actually, a circular went out from the Health Department today that formally said that the EBDS is now scheduling people of 50 plus already at both private and public sites. That started for today, so many people will get SMSs this week, 50 plus, who will be vaccinated this week already. And Gauteng over the weekend issued a press release inviting all 50 plus people at public sites to do walk-ins. So if you are 50 or older, between 50 and 59, and obviously also 60, you can do a walk-in at any public site in Gauteng. There were, however, problems today with a few sites that didn't get the message and they didn't let people in, but it seems to be addressed. And the other big change that there has been over the weekend is the Health Department had a previous policy that said that people without medical aid couldn't do walk-ins at private sites unless they were 80 years and older. And that is now changed. The Health Department says they will commit to paying for all walk-ins of uninsured people at private sites. They can't legally force the sites to take uninsured people for walk-ins, but we've already seen Dis-Chem, for instance, announcing today that it will take any type of walk-in, whether you are on medical aid or without medical aid. You can go to a Dis-Chem site and get vaccinated. That's
really great news, Mia. And while the idea of vaccinating more people from different age groups must be welcomed, does this have anything to do, or does this tell us anything about the rate at which the vaccine has been picked up by those that are above 60 and older?
So 60 and older definitely declined. The Health Department announced it on Friday, and that is why they opened up the vaccinations for a younger age group as well. In some countries, there's evidence that when you open it up for a younger age group, such as 50 people are 50 and older, then they tend to take people of 60 and older along with them for vaccination. So it helps a little to get older people who hadn't been vaccinated also to sites. So that has declined, but there seems to be efforts now to specifically target people of 60 plus. For instance, in Gauteng, this week they launched in 3 districts, including the city of Johannesburg, mobile sites and also free transport to those sites for people who would like to get vaccinated. And those are efforts that definitely didn't exist last week. So there is an effort to go into communities and to get the people and take them to the vaccination sites, and in some cases to also have pop-up sites to take the vaccines to people in communities.
Some of the news that has also come out of the weekend, Mia, has been around the Sinovac vaccine and SAHPRA really giving the go-ahead for the distribution of that vaccine locally. Let's talk about what this means for the Health Department. Are we going to be procuring vaccines from Sinovac, and what do we actually know about its efficiency?
So about its efficacy, we have trials in various countries. In about 5 countries, trials have been conducted, and all those trials came up with different efficacies. So for instance, in Brazil, that's the figure that's quoted most commonly. It showed that the vaccine protects against any form of COVID, 50% protection that it provides. But there were other countries, for instance, Turkey, where it was much higher, 84%. And the company argues that it was lower in Brazil because Brazil's trial was among healthcare workers who are much more exposed to the virus than, for instance, the general population that was used in Turkey. If we look at SAHPRA's decision, they did not state efficacy on their press release. They also did not provide data as to whether Sinovac is effective against the Delta or the Beta variant. We just know the company that Sinovac works with locally in South Africa, Novolax, has said that lab experiments have been conducted that showed that it was effective, but no figures have been released. SAHPRA did say that it will, and the Health Department as well, that it will announce data at a later stage. SAHPRA has nothing to do with procurement. So all SAHPRA does is it tells us whether a vaccine is effective and whether it's safe. The procurement depends on the health department, and the health department also needs to take recommendations from the Ministerial Advisory Committee in consideration. And the South African Medical Association over the weekend was upset, issuing a press release saying that the Ministerial Advisory Committee, according to them, have not yet received such data. So we would now have to hear from the health department whether they have provided data to the Ministerial Advisory Committee and what they will do. Will they procure or won't they?
Is that unusual, Mia, that SAPRA did not provide this data and that we seem to have such little data around this vaccine that has now been approved?
Well, SAPRA is supposed to have a full report and to release that report to the health department. And over the weekend, the health department said it was still studying that report. I've seen various versions of press releases from SAPRA when vaccines get approved. Sometimes the efficacy rate's in there, sometimes it isn't. Sometimes it tells you quite a few details and sometimes it doesn't. So no, I don't think it's so strange. I've seen versions of other vaccines, for instance, with J&J and Pfizer. For instance, with Pfizer, they didn't tell us all the details as to which age group could use it. So I think all we can do at this stage is to wait for the health department and see what they decide. In the meantime, we are expecting another Pfizer batch this week. It was supposed to arrive this evening. Now it's been postponed to Wednesday, and that will be another 200,000 Pfizer doses that will arrive in the country.
Mia, thanks for the brief as always. Mia Malan is with the Bhekisisa Centre for Healthcare Journalism.